Welcome back to Jersey Matters. I'm Larry Mendte. Some chronically ill inner-city New Jersey residents make dozens, sometimes hundreds of trips to the emergency room every year because they don't have primary care doctors. And that's expensive for New Jersey and for society as a whole. Now, Vanessa Tyler with the story of a nurse at Rutgers Newark who is harnessing the power of community to improve the health of their neighbors. Vanessa.
Well, Larry, this could be the answer to the question, am I my brother's keeper? In Newark, a program with Neighbors Helping Neighbors has real results when your neighbor is trained to save your life.
It is time to go check on Miss Ruby. Lillie is on her way, walking in Hyatt Court, a housing development in Newark. Leonda lives here too. Miss Ruby depends on her to stop by.
Good morning, Ms. Ruby.
You're seeing the Rutgers Community Health Program in action. Door to door, neighbor to neighbor, home to home. Happening not just at Hyatt Court, but at a handful of other Newark houses too.
I'm here to take your blood pressure. Is that fine?
Yes.
Keeping people like Miss Ruby healthy is what the program is all about.
We started to make changes and people came to trust us, and we really started to develop a practice when there was nothing.
Cindy Sikora started this back in 2010. As a professor at Rutgers School of Nursing, she wanted her students to have real-life experience, so they went out into the community.
And I thought, you know, if we could bring a nurse and community health workers together on the grounds of places like Hyatt Court and Terrell Homes and Pennington Court, perhaps we could make a difference.
She applied for a grant and got it. Almost $1 million from the Health Resources and Services Administration, a federal agency. Ms. Ruby's pressure is fine, giving her peace of mind.
I feel secure because if I can't get to my doctor when I need to, or I can't get my medication when I need to, they're there. You know, they're there every day in the week.
In addition to the home visits, men, women, old and young can drop by the Rutgers Jordan and Harris Community Health Center right there on the grounds. There's also a mobile unit that travels to the different developments. The Jordan and Harris Health Center gets part of its name in honor of longtime Hyatt Court resident Lillie Jordan. She is now 82 years old. If not for the center, she might not see 83.
And I had an emergency bed about 4 years ago, and the community helped me. My pressure was up, and they checked me, and it was high. They sent me to the hospital, and I was on the verge of a heart attack.
Community health worker supervisor Victoria Lane remembers that day.
I checked her pressure. I looked at her. She didn't look like her usual self. Her blood pressure was high. I called the nurse and told the nurse what was going on, and then I called 911.
There is always a nurse the community health worker can consult. So happens, Cindy was the nurse on duty.
Over the past 10 years, we've made a difference in a lot of lives, and Miss Lillie is one. I mean, we saved her life that day.
The nurses supervise, but it's the community health staff who are trained to check blood pressure, sugar levels, and get the patients to open up.
A resident in the neighborhood where we have our centers is an advantage because they know us. Usually people don't want to go to their doctors because they're like strangers and they use all of this medical terminology that they don't understand, whereas here we speak in a language that they can relate to, so they understand us better.
These folks don't trust anyone. It's taken me 10 years to get the trust I need for them to come to us for a flu shot, for them to bring their babies to us for vaccination, for them to trust us coming into their homes.
It's a program that's much needed in a community like this, a community where instead of going to the doctor, they'll use the ER as their doctor. So now that we're here, they're able to come here and be screened by our nurses and community health workers and nurse practitioners.
Since most here qualify for health insurance, the community health workers can encourage their neighbors to see their doctors and be the bridge when they don't.
Okay, so your blood pressure numbers are a little high.
Something else has come out of this program. Some of the community health workers have found their calling.
I've always been told ever since I've been working that I'll make a great nurse. So I've decided to go to school for nursing.
Yes, this job motivated me.
Leonda plans to pursue her passion all the way to medical school.
My plan and my goal is to become an anesthesiologist or a pediatrician. Okay, bye, Miss Ruby. See you next week.
Medicine and so much more. Now, the knock on the door can save a life, save a community. For Jersey Matters, I'm Vanessa Tyler.